ParaMyxoViridae is split into 5 genuses: respiroviruses, alluvoviruses, morbilliviruses, hennepaviruses, and pneumoviridae. Respiroviruses had bovine parainfluenza 3, alluvovirus had Newcastle disease, morbillivirus had rinderpest, pest ruminants, and canine distemper, hennepavirus had hendra and nipah, and pneumoviridae had avian metapneumovirus and bovine respiratory syncytial virus. Rinderpest means cattle plague. It was a devastating disease that led to the foundation of many veterinary schools. It was the rinderpest morbillivirus. It was eradicated from Hungary in 1881, and the world was free of rinderpest in 2011. There were 3 genetic lines, and the resistance was low. The hosts were cattle, sheep, and pigs, and it adapted to new hosts, which led to pest ruminants and measles. The virus was maintained by cattle, and it was shed in the excretes. It was able to survive in frozen meat. The virus entered the body orally, and then it replicated in the lymph nodes of the throat. And then viremia would occur, and it would spread the virus to the bone marrow and the lymph nodes and the mucous membranes. In the clinical signs, there was an acute phase, where they had fever and depression. Then there was an erosive phase, where they had lacrimation and nasal discharge. In the pathology, we could see the epithelium and digestive tract would have hyperemia and hemorrhages. The upper respiratory tract would be affected, and so would the digestive tract. In the digestive tract, there would be blackening of the large intestinal folds. These were known as zebra stripes. The peracute form of the disease was in young animals, and they died. And then the subacute form was the one with the lacrimal nasal discharge, and they generally had no diarrhea. In sheep and goats, they had diarrhea without lesions, and swine often had erosions and diarrhea. For the diagnosis, we can now do PCR and ELISA. The differential diagnosis was foot and mouth disease due to the lesions on the mouth, malignant capital fever due to the nasal discharge and respiratory signs, and bovine viral diarrhea due to the lesions on the mouth. And it's still a notifiable disease. Even though it's successfully eradicated, there are vaccines still available in stock. They are attenuated. Pest ruminants is a virus that is similar to rinderpest. It is found in Greece and Romania, in the Balkans, and in Africa. There are 4 genetic lines. Genetic lines 1 and 2 are found in West Africa, and genetic line 3 is found in East Africa, and genetic line 4 is found in Asia. The virus is found in goats, sheep, and antelope. The virus entered the body orally, and then viremia occurred, and then there was replication on the epithelium of the mucous membranes and the lymphoid cells. In the acute form, the small ruminants would get purulent nasal discharge, cough, and conjunctivitis. They would also get necrosis of the oral epithelium and salivation, as well as having laboured breathing and abortion. In the pathology, around the oral cavity, there will be ulcerative inflammation and hemorrhages. And in the gut, there will be hemorrhages, enteritis, and the zebra stripes, which were also found in rinderpest. And since it's a virus, the goats and sheep will have interstitial pneumonia. They can also get hemorrhagic diarrhea. For the diagnosis, we can use PCR and ELISA. And the differential diagnosis is Pasteurella, foot and mouth, and contagious caprine pneumoniae. There is an attenuated vaccine that is given at 3 months, only in endemic areas. Canine distemper is similar to rinderpest and pest ruminants because it's a part of the morbillivirus genus. The virus is found worldwide, however, the clinical form is not common. It is a uniform virus, however, it has 7 genotypes, and the virus has low resistance. The virus is maintained by dogs, however, the host range is dogs, ferrets, bears, raccoons, and in cats it's self-limiting. 7 days after infection, canine distemper virus will start to shed, and it will shed for 2 months. 75% of dogs are asymptomatic. The virus can enter through the oral or nasal route and will go to the regional lymph nodes. It will then spread to the lungs and the digestive tract, and then secondary infections can occur, like Bordetella bronchoseptica and Pasteurella multisida. In the clinical signs, the animals will have purulent conjunctivitis and uveitis, as well as a dry or wet cough and nasal discharge. The dogs will have vomiting and diarrhea, and they will also get hyperkeratosis on their nose and paws. They will also get central nervous system signs, and there will also be signs in the fetus as well, and the dogs can get abortion. The dogs will also get hypoplasia of the enamel, as well as interstitial pneumonia, and gastritis, and cardiomyopathy. For the diagnosis, PCR and ELISA are sufficient for diagnosis. And for the differential diagnosis, for the CNS signs, it can be rabies or Jeskies. For the respiratory signs, it can be kennel cough, and for the gastrointestinal signs, it can be infectious canine hepatitis. There are attenuated and inactivated vaccines. Dogs typically need a vaccine boosted every 3 years. The henipaviruses are to describe diseases caused by two different viruses, Hendra virus and Nipah virus. For Hendra virus, it was found in Australia, and the last case was confirmed in 2011. Flying fox bats were the reservoir, and they were asymptomatic. And the virus was able to infect horses and humans. It was a zoonotic disease, however, there were only several cases. Horses got infected from excretes from flying foxes that were on infected fruits. They were also able to get the virus off other horses. The virus replicated in the lymphoid tissues of the upper respiratory tract, and then viremia occurred. And then the endothelial cells were damaged and vasculitis occurred in the lungs, airways, as well as the brain. And this led to ataxia, spasms, and central nervous system signs, as well as respiratory signs. In the pathology, one could see edema and interstitial pneumonia. And for the diagnosis, it could be diagnosed with PCR and ELISA. And there is a vaccine available in Australia. However, the virus is pretty much non-existent anymore. The Nipah virus is very similar. However, it occurs in pigs and dogs. Just like Hendra virus, flying foxes are the reservoir, and they are asymptomatic. The infection came from their urine and excretes that ended up on fruits. These fruits would either be inhaled or smelled by dogs and pigs, and then the virus would get into their body. The virus would replicate in the upper lymphoid tissue of the respiratory tract, and then viremia would occur. And then, just like Hendra virus, the endothelial cells were damaged and vasculitis would occur. In the pigs, they got spasms, ataxia, and just typical central nervous system signs, as well as respiratory signs such as coughing and nasal discharge. And dogs had similar signs, and in cats, they just seemed to get respiratory signs. The main pathological features in pigs and dogs were pneumonia and encephalitis and vasculitis. For diagnosis, we can use PCR and ELISA and viral neutralization. And there is no vaccine available. For prevention, just make sure these animals do not come in contact with flying foxes. Both Nipah virus and Hendra virus are zoonotic viruses. In humans, they can also cause respiratory signs and CNS signs. Avian metapneumovirus has one serotype. It is found worldwide, and birds are frequently seropositive for it. There are also a lot of cases in the United States, Ireland, and Great Britain. There are 4 subtypes that go from A, B, C, and D. There is a higher mortality in turkeys than there is in hens. It happens most frequently in animals between the ages of 4 weeks and 9 weeks old, and there's a fast spread. It's spread in the nasal discharge, and there is no germinative infection. The clinical signs for this virus are turkey rhinotracheitis, swollen head syndrome, avian rhinotracheitis, and duck rhinotracheitis. In turkey rhinotracheitis, they get lacrimation, as well as nasal discharge, coughing, sneezing, and sinusitis. There's also a decrease in the egg production. In swollen head syndrome, they get sneezing, nasal discharge, and lacrimation. They also have severe head edema, as well as sinusitis, and there is often co-infections with E. coli. For avian rhinotracheitis, it's a milder disease, and there is a drop in egg production. The eggshells also become white as the eggshells have less pigmentation. And for duck rhinotracheitis, they get respiratory signs and decreased egg production. In the pathology, it's often shown that the animals die from suffocation and pulmonary edema. There is also cytoplasmic inclusion bodies and degeneration of the oviduct. For diagnosis, we can use PCR and ELISA and viral neutralization. The differential diagnosis can be Newcastles disease, avian influenza, and infectious bronchitis. It can often be treated with antibiotics, as there is often secondary infections. And there is a vaccine with the A and B strain. It is an attenuated vaccine that can go in the drinking water or be sprayed in the eye. It is given when they're 1 day old and later when they're 4 and 6 weeks old. There is also an inactivated vaccine for the breeders. For bovine parainfluenza 3, it occurs worldwide. The etiology, it's the parainfluenza 3 virus, and it occurs in cattle, sheep, and goats. It is more common in the winter and after shipping or transport, and it's a part of bovine respiratory disease complex. The virus enters through the nose and then it replicates in the respiratory epithelium. This can cause hyperemia and necrosis in the lungs. This virus is located only in the respiratory tract. And as a result, they get respiratory signs, such as nasal discharge, cough, and conjunctivitis. And the virus also causes secondary bacterial infections, which are more severe. And in the pathology, we can see interstitial pneumonia and bronchitis, and tracheitis. The virus can be diagnosed using PCR and ELISA, and for prevention, we can vaccinate the pregnant mothers, as well as giving an intranasal spray to the calves when they're 3 weeks old. Bovine respiratory syncytial virus is very similar to parainfluenza 3. However, bovine respiratory syncytial virus is part of pneumonoviridae, and parainfluenza 3 is a part of respiroviruses. It has 1 serotype and 6 genotypes. Just like parainfluenza 3, the hosts are cattle, sheep, and goats, and it's found worldwide. The most frequently infected animals are animals between the ages of 6 and 24 months old. It is part of bovine respiratory disease complex, and just like parainfluenza 3, it's more common in the autumn and winter. It occurs through an aerosol infection, and then the replication happens in the alveolar epithelium, and then it causes alveolitis, bronchiolitis, and interstitial edema. The virus can cause secondary bacterial infections to occur. Clinical signs are laboured breathing, dry cough, dyspnea, and nasal discharge. And in the pathology, we can see cytoplasmic inclusion bodies and tracheal hemorrhages and foam, as well as interstitial pneumonia, just like parainfluenza 3. For the diagnosis, we can use PCR and ELISA and viral neutralization. And in regards to the vaccines, they generally don't vaccinate the mothers, just the calves, when they're 6 or 2 months old. There is an attenuated vaccine that is given as an intranasal spray.